But this is such a huge story. I know so many people that have waded into this. Wegovy, also marketed as Ozempic for diabetic patients, is available in pill form. How does all this change the weight loss drug landscape?
Well, really, this is a game-changing time in the world of weight management. While many people have come to terms and adopted the idea of weekly injections for weight loss, just like they've done for diabetes, some people are reluctant to do so. And also, some doctors are more reluctant to prescribe injections because of the constant changes in doses and some of the difficulty with administration because these drugs require refrigeration, et cetera. So this can make it easier for patients to take and easier for doctors to prescribe.
Also, now I've also read that there are some difficulties that could come with the injections, digestive issues, maybe problems with gallbladder, spleen, things like that. Do the pills change that at all? And is that a problem, or has that been worked out?
The currently available GLP-1 agonists, or what we call incretin mimetics for weight loss that are available in injectable form, are the same drugs, specifically semaglutide, that's in the new pill from Novo Nordisk. So it's not a different compound, it's just a different formulation, and thus it has the same potential side effects, but just a different prevalence of the side effects. The side effects are slightly higher with the pill than they are with the injectable.
Interesting. So, well, the pill is being billed as a cheaper alternative to the injectable weight loss drugs, but it's still, I guess, somewhat pricey, $149. But both Novo Nordisk and Eli Lilly offering direct-to-consumer, willing to pay out of pocket, and it seems like the consumers are lining up to weigh in and purchase these.
Yes, both drug companies have done an amazing job with increasing accessibility, especially in light of a year and a half ago, there were significant shortages of these medications, which led to a lot of frustration and issues with side effects because of missed doses, and people really weren't able to have consistent medication. So offering these direct to consumer can provide more access. The patients get the drug mailed directly to their home, whether it's refrigerated injection or if it's the oral version can be shipped now as well. And the lower price makes it more accessible. They've also lowered the prices in November and December 2025 from the thousands for both tirzepatide and semaglutide to now the hundreds.
And I've heard a lot of people very frustrated that insurance companies in the United States, for the most part, aren't covering many of these weight loss drugs. Considering that it could bring down weight and thus reduce so many medical problems that come with that, heart issues, all kinds of things. Do you think that there could be a shift in this realm moving forward, Doctor?
Well, you know, we have private insurance, which is given by the employer, and public insurance, which is provided by the government. So the government does not cover weight loss drugs under any circumstances at this time. Private employers may cover it for their employees, but some of these self-pay options are so affordable now that the employers are letting the patients use their own medication resources with their own money. But the prices are changing over time to allow a little bit more accessibility, but it's still frustrating.
You know, this next stat was pretty eye-popping to me. We're seeing the competition have some information behind it. Some people that took the Zepbound medication lost about 50 pounds on the average compared to Wegovy. People lost 33 pounds, both amazing weight loss medications. But does this incentivize Eli Lilly, which makes Zepbound, to make their product more accessible to a wider market?
Well, though drug companies are interested in our health, they are still a business. And the more expensive of those two drugs does have the greater weight loss in the trials. So as they've lowered their prices, there's a time when they price match, but it seems to always occur that Lilly's tirzepatide tends to be slightly more expensive than semaglutide in any version, but the weight loss is slightly higher.
Tell me what you see moving forward this year. What are we going to see more people turning away from the injections, I guess almost exclusively going towards the oral medications, and do you expect this explosion in popularity to continue as well?
Explosion is a good word. I do expect there to be a boom in the prescriptions for the oral medications. One, because doctors are very versed in prescribing pills, even though there is a titration or slight increase, maybe monthly with the oral medication. Patients are used to taking pills, and this just is something that's more comfortable for them. And they may not see it as such an extreme measure as injecting themselves weekly. So I expect these pills to have an increase in popularity. Some people may switch. Overall, going forward, I tend to keep patients on their injection if they're on injection, and maybe reserve the pills for people who are self-paying or those who are really averse to needles, because the injections have slightly more weight loss efficacy than the pill.